Welcome to Critical Questions, a series which covers various dimensions of the COVID-19 pandemic. Today, we're going to talk about why COVID-19 has disproportionately impacted communities of color, especially African Americans. While racial data is not widely available, the Associated Press conducted an analysis of regions that had released this information and found that even though African Americans accounted for 21% of the population, they comprised 42% of the COVID-19 deaths. To learn more about this trend, we are joined today by Dr. Ebony Hilton, Associate Professor of Anesthesiology and Critical Care at the University of Virginia. Dr. Hilton, thank you so much for joining us.
Thank you for having me.
So, why do you think this pandemic has been particularly devastating for communities of color and especially African Americans?
All right. So when we're dealing with this idea of racial health disparities, it's nothing new. If you look at the infrastructure of what makes up all the social determinants of health, and whether that's access to care, whether that's even the things that lead to hypertension and diabetes, as far as food deserts and the eateries that are not predominantly placed within the African American communities. If you're looking at even factors of poverty and the issues that surround redlining, that began back in the 1930s, the neighborhoods aren't structured for economic growth. And so when you combine all those together, we've had racial health disparities for, literally since the beginning of time in the United States. And so when I first heard of COVID-19, the first case was January 17th, 2020 in the United States. The first death being February 29th, 2020. I knew we were going to be in an uphill battle.
Wow. And, research done by doctors at the universities of Virginia and Pittsburgh, it was done recently, found that communities of color have had more difficulty accessing tests despite showing symptoms. And we know that, testing is not widely available, but why has the African American community why has it been so difficult for the African American community to access those tests?
Right. And again, this isn't new. As far as access to care, as far as testing ability, as far as diagnostic procedures being done, African Americans have historically always been behind in terms of other races. So I'll give you an example. There was a study out of University of Florida. This was back in 2012, I think it was, the data collection of where they looked at over 26,000 cases of patients who presented with complaints of chest pain. We obtain a value called your troponin levels that tells us how much injury the heart has had. And what they wanted to see of these 26,000 patients, how many of those received a cardiologist, the heart doctor consultant, and then how many of those actually received an intervention as far as heart catheterization to look at the blood vessels that surround the heart to see whether or not there's an active heart attack happening. And what they saw is that statistically, if you're African American, you're less likely to get a cardiologist consulted for you, and you were less likely to get a procedure to look at the arteries of the heart. And that was with you having the same presentation as far as your chest pain. That was with you having the same presentation as far as that enzyme in your blood being higher. So this is not new. With COVID-19, the thing that's most concerning for me in the beginning was it is so subjective. The person complains of chest pain. They complain of cough. They complain of headache or fatigue. I can't put a number to that. Not everyone presents with a fever, so that's not even as far as a truly objective finding. That's not always consistent, and so I knew if there was this potential for the interpretation of how severe your illness was to be a determinant of whether or not you got the test or not, I knew we were going to be in a problem because there is a tendency to have implicit or explicit bias influencing whether or not someone is going to get tested, whether or not someone is going to get treated. So, yeah.
Sure. So there's still a lot of racial and ethnic data that is missing when it comes to COVID-19 infections and deaths. Is it because it hasn't been collected widely enough, or do you think it's because it has just not been released by states and the CDC?
At this point, I'm not sure which one to know. I know there's a lot of privatization of the testing. And with that, these private companies that are doing the drive-through testing, what are they reporting? What are they collecting as these individuals pull up into their cars? Not sure. What I do know is that even so for instance, the CDC released a report, MMR, and I'm not sure if you're if your listeners had a chance to look at it, but what they did was they had 14 states. Now, if you look at the cherry picking of these states, if they were looking to kind of do an analysis of racial health disparities, these wouldn't be the states that I would choose. For instance, of the 14 states, only 2 of them ranked in the top 10 as far as the population of African Americans, with a percentage of greater than 30%. The remainder, 12 of those 14, ranked between 15 to 46 as far as the total population of African Americans, including Utah and Iowa, which had less than 3% African Americans. So, wow. What are we targeting here? And then even of the states that they chose to analyze, this 14 states, of the 1,400 patients that they analyzed, of which we have 300 million in America, but of those 1,400 patients, only 500, a little over 500, had reports of race. So that tells you just how infrequent we're actually documenting along the lines of race, which to me in 2020 is absolutely inexcusable. When we know that racial health disparities across the board, not only for African Americans, but Native Americans, we know that even our language also plays an influence on this. So knowing what someone's primary language is and making sure they're getting equal access to care is important. And so, absolutely. Yeah, so it's not being documented. It's not being released. And that to me is a signal that is not deemed important. And it is important. Absolutely. Yeah.
And why is it important to have data that is disaggregated by race and ethnicity? Can you just sort of explain for our audience?
Right, because what we know is that race has been identified as a independent risk factor, meaning that, so for African Americans, for instance, you can have higher income level, you can have a higher educational attainment, you can live in a quote unquote better neighborhood with better access to care and better resources, and still have worse outcomes than a white person with lower educational attainment, lower socioeconomic status. And so it doesn't, not to say that I think there should be a 2-tier system, but what we know is that there is a 2-tier system, and it oftentimes falls along the lines of race. And so if we're seeing that a population, a group of people are dying at 2 to 3 times their population percentage, then we need to figure out the why of that. And especially, like I said, if it doesn't fit a certain scheme, if they don't all belong to the same neighborhood or access to the same healthcare system, or if the resources aren't equal amongst those 2 groups, and yet their numbers are the same, then that tells me there may be something wrong with the system itself. And if it's the cost of someone's life, every single issue along that list needs to be investigated, because everyone's life is important.
Absolutely. And, you very eloquently mentioned that there is a long history of institutional and structural racism when it comes to communities of color and their access to healthcare. Right. But what needs to be done now in the middle of this pandemic to reduce the fatality rate within communities of color?
Right. I think the now is if we know this is this. I always say if it happens once, it's an accident. If it happens twice, it's a pattern. So if we know there is a pattern of these health disparities happening within these targeted communities, then we target resources towards those communities. There should be a drive-through testing or a mobile testing even for that community itself. That means taking masks and PPE straight to that community itself. We know that 1 in every 5 African Americans can stay home for work, and the rest can't. Right. So if we have that large percentage of people that are deemed essential workers, and they are working in the grocery stores, and they're working in the Walmart and Targets, these large retail systems to keep the nation afloat. If we're depending on them that greatly, then we should also protect them that greatly. And that means doing educational training for them during this time of epidemic or pandemic, to give them the PPE they deserve, and then also to allow for testing for them, not only in their workspace, but follow them home and test them and their community members there. And that's the way we can truly kind of quelch this spread amongst the African American community.
Absolutely. Dr. Hilton, thank you so much for these very important insights. We greatly appreciate your analysis and expertise.
Thank you so much. Have a great day.
Thank you.